And welcome back. It is a story to make any parent cringe. When our next guest was a child, he split open his forehead from a water skiing accident and he needed plastic surgery.
That's right. Dr. Todd Van Yee is here from the Center for Aesthetics and Plastic Surgery, and he's going to tell us how that experience has affected his life and how he helps people around the world today. Welcome to the Morning Blend.
Thank you very much for having me.
Great
You
to see
cut
you.
open your forehead.
Yeah, it was not a pretty sight.
No,
I hit
it was a big one.
I hit another boat, split my forehead open, spent the next day in the hospital getting fixed.
Wow.
Yeah.
And that brush with plastic surgery or that experience
Well,
helped you determine your career, right?
Yes, and that was one of the episodes in my life that helped direct me toward plastic surgery. The other thing was that when I was probably about the same age, grade school I suspect, I saw a special about 3 plastic surgeons that flew small airplanes through Africa. They're called the Flying Doctors of East Africa. All 3 plastic surgeons, and I said at that point, that's what I want to do.
Really?
Yeah.
And what was it about that drew you? Was it the mission kind of work that they were
it's-
doing? Was it the fact that they were doctors?
It's the fact that they were helping people. They were going to very remote areas, helping people that would have not gotten any help any other way. They were doing challenging cases. They're improving the quality of life.
Yeah.
It was just wonderful.
Where
Yeah.
do you do your mission work?
Most of the time, for the last 16 years, I've been to Congo, the Democratic Republic of Congo, which used to be called Zaire. We go to a very remote area right by the Rwandan border. This is the same place where the genocide took place in the 90s. So it's a very, very impoverished area, very desperate for health care. And that's where I've been going for 16 years. I actually spent 2 months in Africa when I was a medical student as well, and that's what I love with Africa.
What do you see there that needs help? What are you able to do for the people in the Congo?
Most of what I do are cleft lip and palate surgery. In fact, I trained one of the Congolese surgeons that I work with over the last decade, and he actually just recently won an international award for his work with cleft lip patients
That's
in Congo.
exciting.
When I first started going in 2002, nobody in the country knew how to fix a cleft lip. So I would work on parents and their children, all that came presenting to the hospital with cleft lips. So
Because most people are born with it, right? It's a birth defect?
it's a birth defect, and they're born with the cleft lip. And I do a lot of burn management as well, too.
Okay.
Is a cleft lip, we're looking
Wow,
at an
look at that.
incredible transformation
Yep.
there in that before and after picture. Is it more common there, or is it just much
It's-
less likely to be addressed and treated?
It's not necessarily more common in that the incidence per birth is greater, but none of them have been fixed.
Right.
So there's a lot of patients that still have one. That's just an example of why plastic surgery is such an optimistic field. In a few hours, we can change somebody's life.
Absolutely.
Yeah.
I can't imagine then having to go through adulthood, not being able to eat properly or have all the, the workings of your mouth the way that we all, are
Right.
so lucky to be able to
Take for
have.
granted. Yeah, for sure.
So when you're there in the Congo, you take those experiences. Do you do palates, cleft lips, all that stuff here as well, or do you do more cosmetic?
I do everything that falls under the big umbrella of plastic surgery. A lot of it's reconstruction, facial reconstruction, trauma work, breast reconstruction for breast cancer. But I'd also do a tremendous amount of aesthetic or cosmetic surgery as well, too. And I think one helps complement the other one.
Yeah. Do you
Yeah.
like doing one over the other?
I love it all. That's why I like plastic surgery so
Yeah?
much. Yeah.
Well, it was funny because hearing your story, your original story of the boat accident, I was looking at your forehead. I'm like, I don't see any scars. So you clearly had a really great, plastic surgeon, and that's something I'm sure affected you growing up.
It did. Unless I point it out to patients, nobody can tell where the scar is. I mean, it's there if you look closely enough, but you can't tell that. And that's why plastic surgery is such a wonderful field, is that we're making people look, and I'm not sure if this is always the right term, but normal.
Yeah.
They look natural, without scars, without the deformities, or without some of the things that happen with diseases or even the aging process.
Yeah.
Well, and that brings up a good point. I think so often, and we tend to think of plastic surgery as something that people do that's very, very vain, maybe, let's say, or people just want to look better or change their look. But this brings up the great point that sometimes people are in accidents, sometimes they're born with deformities. There are a lot of reasons for plastic surgery, accidents, things like that, where people need plastic surgery just to get back to how they used to look.
And that's one of the reasons I feel so compelled to talk about plastic surgery, to teach people. It's obviously the bizarre things that hit the tabloids. And
Yes.
we've all seen those goofy
Extreme
results.
cases.
But most of the time, whether it's reconstructive or even the cosmetic things, people just want to feel okay about themselves. They want to feel normal, or they want to feel natural. And that's what we can offer patients.
Yeah, I think it's incredible work that you do. So I know that you get a lot of joy out of the mission work and obviously the stuff you do here as well. So you have complimentary consultations right now for the first-time patients, a discount of 20% and loyalty discounts and referral programs. You can learn more about the board-certified plastic surgeons and the mission work of Dr. Todd Van Yee at the Center for APS.com in Mequon. Call this number for an appointment for that free complimentary consultation at 262-518-2232. Thanks for being here.
Great. Thank
Great
you very
to see
much.
you.
It's
Thanks
nice to
so
meet
much.
both of you.
Thank
Appreciate it.
you.